can be curtailed. So now the purpose then they really for the wrap-up meeting. And the wrap-up meeting, they get different stakeholders then from all sectors were involved in the project for come together and see how best then we push the project forward.
Now the wrap-up meeting, and they develop a memoir, put in the catalog all the issues there, within the catalog. What is the success of the project?
And the project gets a lot of successes really because the project gets 4 components. Of the 4 components, component 1 they look at water and sanitation infrastructure, in which the project they rehabilitate 1,583 water points and water wells and with them they don't exist but people are not able to use them. They also get public sanitation facility of 396 PSF VIP latrines and where the project they construct. They get gravity fed water supply systems the way 15 the project they construct in Kono and Koinadugu. They get new hand dog wells them where the project they construct 446 new hand dog wells. They get spring boxes, so different facilities then they within the project where the project they construct. And contract award pending from different institutions. The council get contract by procurement arrangement where they keep 5 initial council, that is Cambia, Koinadugu, Kono, Puchon and Bond District Council. So within this period, project we look at the achievement made in constructing land facilities then for beneficiaries.
You don't talk about the successes then, So what are the challenges then where the project don't face?
The project gets a lot of challenges then really, and at the very reason that we make them flag the project for low disbursement twice, 2 occasions then. One of the challenges really where the project we face now the slow pace of progress of construction work. Most of the contractors then when they award contracts to at the local level and at different levels really not get that kind of capacity for push the work as required, because most of these works then are 6-month contract and waiting for they don't complete, but most of them take a period of 2 years for implementing. So this now one major challenge where the project face and we currently the face, but thank God all the stakeholders them don't come together and put measures in place for see how best them will curtail some of them challenges. Then currently termination letters them don't give to non-performing contractors since December last year 2018, and progress of construction work don't increase considerably of infrastructure.
So you talk about the termination letters the way they don't give to non-performing contractors then. So I don't give them the letters in there.
Yes, in December 2018 non-performing contractors were identified, contractors the way they below 50% progress from when they award contract to them, and other performing contractors the way they are above 80-90% construction work since they award contract to them. So within that period all contractors where they below 50% in December we are giving letters of warning or termination. So we realize that because as per contract we give warning like 1 month duration before termination. Progress don't happen considerably, and currently most of the contractors they don't improve, and the issue of most of the project them when are ongoing works will be completed within from now to end of May.
So other thing again that the project never achieve much, that just we quantify per percentage, that the percentage low.
No, the percentage progress really not that low, but if you look at timeline, because in project management we get a lot of things the way they look at. You look at the cost, you look at the timeline, you look at the scope of the work. If you look at the timeline of the project, currently we get only 2 years for implement this project, and progress is at 58%. So we need 42% for complete the entire project. That is infrastructure, the capacity building, and all other components. So because of this, I make we say we need to improve and expedite.
So what's the duration?
The duration for the project currently now 2020 December.
Well, that's na engineer Yakuba Jusu Tarawali na Salwako be they talk about one wrap-up meeting with Ministry of Water Resources and other stakeholder them na the African Development Bank being get with Salwako, outside them go review the project where then they do. The program is still a listen to on a midday show where they come to you live from the Society for Radio Democracy 98.1 FM. For make government and partner them know within some of the facility them within the health sector, make the Ministry of Health be do one survey for collect data information and know within the health sector. The Minister of Health and Sanitation, Professor Alpha Tijan Wuri, don launch the Service Availability and Readiness Assessment 2017 report. Outside the research publication specialist na the Ministry of Health and Sanitation, Edward Fori say, them fair not span the survey say na about 35% of medical doctor them na the country na volunteer or part-time doctor them. We make the recommend say the health sector need more doctor them as staff. Edward Safa talk more to reporter David Van Boy inside this interview.
Now, SAR it means Service Availability and Readiness Assessment. That they try for tell we the service them where they now our health facility across the country. And that means we've been going to all health facilities inside Salone, private and public. But now the first thing the survey don't look at all facilities, public and private together. So now we do a census, not to even a survey, a census of all facilities. And they tell you what in day now and what in no day, how you able to do work, whose workman you get, which kind of equipment you get, which kind of drug you get, which kind of drug you not get, you know, which equipment you get or which equipment you not get. And that's essentially the SARA survey they tell me.
Why una do this survey and why SARA?
We do this survey because, for example, after the Ebola, the Ebola that hits the country so hard, we not been so much that happens until they don't boil, people then die, facilities don't close. So we want to see what's in our situation now. So we want to know, like, for doing a baseline of what's in the situation at the health sector, even just after the Ebola, for know what's our team up now before we're going to have a plan for improve what we get. Because if you don't know what you get, you're not going to have for improvement. So we do have to know what thing we get now and have for improvement.
From the survey, we do it and some of things that we have not and put together.
But putting their way not there. So we get basic thing there. If you go on our facilities, or even for example, common contraceptive is not there, lacking in many of the facilities. The inpatient bed is so small. Side away we need 25, sometimes you only get 6. For example, now the country average down there, or 6.4. You understand? So, and essentially down at 6. So it shows say there's so much lack. Inpatient bed, maternity bed for pregnant women, them. It also not there. You understand? Even the workers, they also by right supposed to get 23 core health workers per each 10,000 population. We only get less than 10 people. You understand? We not even get up to 12 or even just about that. Yeah. So it shows say, but good thing the way we not get. We not the drugs then they stock out. We equipment they no day. Even IPC that infection prevention and control IPC infrastructure no day. But good thing lacking. Forget for example emergency contraceptive drugs they not day. Although suggestion they say some of the things actually in stores but not distributor. But that also means say we get supply chain issues because if we get another distributor we get supply chain issues. And so therefore we ask the partners and governments they will help for see how we improve the healthcare system.
The education not there for make people that we serve the work now PhDs they are no say then works there for deliver them or distribute them around the country.
But I'm not going to agree with you say the education not there for let the one way they work in the health sector no say therefore do this. What you are thinking that the issue that the systems that maybe get small problem. If the systems stay in place to make sure say they check and monitor and make sure say what if happen, then I think it will happen. But I'm not thinking that the education not the people they know. But if, for example, you not get a checklist or now you place a way you go for check this and this and go, the system not there for enable you for do your work, that will make you not go do your work properly. So the education there, but the systems now fully there. But thankfully now the current administration they really work towards improving and they don't do a whole lot.
So what are some of the recommendation that we don't come up with for try for solve then help push the health sector go before?
Well, some of them will be, like I don't talk about earlier, some of the things that we recommend for put in place, for example, for increased health workforce, because even the doctor that we get, about 35% of medical doctors across the country, including private facilities, now either volunteers or part-time workers. For what we do now for make we get specialist doctors and let them recruit more staff. The good news also in that direction are the fact that now they already recruit about 1,500 health workers, but then they also get for increase than they eventually. So I think that's a big plus, but at the time we would collect this data, that not been there. And so then I want to be of the recommendations we'll make. We also make recommendation for improve, forgive, like somebody they want to remote communities for Bonds or Kailanko and Dugu for let get some allowance for for relocate. Thankfully also now that done day in place, the current minister don't make good but achieve that one day. But there are a whole lot of equipment and not they stock out there, a whole lot but they're not in our facilities, basic equipment is on then stethoscope, for example, thermometer, child scale, adult scale. These are things we're not really even there. Yeah, they're not there in our facilities. So these are basic amenities for even check somebody in blood pressure. Yeah, it's not expensive. So we need these systems in place and we need this support for make people forget into the facilities. These are some of the recommendations we'll make sure say the equipment and they're available.
Well, that's the Health and Sanitation, the research publication specialist at the Ministry of Health and Sanitation, Edward Fode, be the interview with David Van Boy, outside the talk about one survey we then do. Where the program is still a listen to a midday show where they come to you live from the Society for Edu Democracy, 98.1 FM. Where like as I've been just introduced, I get Pastor Marie Kade Toure, we come out when are the founder for the holistic healing service where they can talk about the nutrition and exercise within they do. And self, I just don't get Miss I just don't get Henrietta Barrow, when are the chief executive officer for the Mano River Entertainment Company, where they can talk about the Miss Mano River Union pageant, where will be April 25th this year na Family Kingdom. Good afternoon, welcome to the program.
Good afternoon there. Good afternoon, listeners. Okay, my name is Henrietta Barrow. People call me Etta. I'm there this afternoon for talk to Una about the beauty pageant show, Miss Mano River Union International Beauty Pageant Show, which comprises of Guinea, Liberia, Sierra Leone, and Cote d'Ivoire for the first time in the history of entertainment and pageantry in Sierra Leone. And we do this pageant not because we want to do an ordinary pageant. This is a different pageant. It is different because over the years we don't raise awareness on gender-based violence. Recently, we teamed with Rainbow Initiative and produced a movie called Hands Off. And because of the awareness raising, we want to take it to another platform, international platform. Now that make we decide, say, let's come together and see people the way we go identify as role model in the form of beauty pageant as ambassadors. We go take time now the Mano River countries and raise more awareness on gender-based violence. This pageant they happen on the 25th of April in a Family Kingdom. And we they bring in representative them from Cote d'Ivoire, Guinea, Liberia, and Sierra Leone. 4 contestants, then they can contest for being Miss Mano River Union. And the whole essence now for let we go able for raise awareness on gender-based violence as the pageant itself with the use sustainable development goal 5 when gender equality and the subtopic there, each of the girls and they use one part the subtopic as their platform. So anybody will win. Now that in platform we they take for tour the Mano River countries and raise more awareness on gender-based violence. And not so just that, the same will say we they help for promote the tourism industry. Tourism industry in Sierra Leone a word of mouth. We go here and say this and that, but a word of mouth. We have so much to showcase when it comes to tourism in Sierra Leone. We get with sightseeing that we get with historical sites and all that. We get bird watching. Now Sierra Leone are the only place who gets birds then where people them for they can watch birds themselves. We get to mining sites and where people them for they can and all that they go help for develop this country and also because of that the domestic tourism we get them but we say Sierra Leone not they practice and people don't know no not aware. So we want to create this opportunity where Sierra Leoneans say we first for begin they go we sightseeing and all because if people then they come on at this Mano River countries they can at this country every year say okay we they can Sierra Leone for can watch Miss Mano River Union and get opportunity for go na the historical places and go na sightseeing and watch that the beauty of Sierra Leone go na the beaches and the hotel and all that that time they we say as Sierra Leoneans and go begin embrace her. So it has to do with promoting tourism and cultural affairs and of course for raise for help we within at the entertainment industry for create market strategy because all the opportunity for produce a movie I go Guinea, Liberia and Cote d'Ivoire premiere and then do and can with artists then let them get shows and where them pull songs and let them music then play. So this event will create all that avenue and opportunities for us Sierra Leoneans and for it and the people that where they live now the sub region and it go create that kind of peace. I remember during Ebola me organization Sierra Leone Lives Matter we raise awareness on Ebola and all that we want go Guinea, Liberia and for go do collabo movies and all that for raise more awareness that may sub-region and all. We find it so difficult to do that collaboration. Reason be that there's never been a time where Mano River countries they come together whether in celebration or for celebrate we act with talent there tourism and it has never been. So this go create that platform for let we get solidarity among the Mano River countries. Let we empower young women then to be specific young women then at the Mano River country for take the lead and be part of the change where we all the yarn for. This event is different from all the other beauty pageant shows government representative there for can represent the country. So it's a huge event where we want let Sierra Leoneans then turn up and give us all the support, because together we can make it happen. Sierra Leone lives matter. If we succeed, it means we all are Sierra Leoneans, because when they can with media people then back where they get for do media coverage, and at the end of the day then they can go dancing and go play another country. We normally then can then go to an event where Sierra Leoneans they not turn up, you know, go sound well for we country. It go be like Sierra Leoneans that we're not supportive and all that, and we want change the narrative when people they think say we're not supportive. Even when people then get brilliant ideas that we're not the support, we want change the narrative and ask people for come out and help. And somewhere so this event we they do in partnership with Ministry of Youth Affairs, because Youth Affairs then know say with this event then will help for empower more young women then for come at the forefront and take the lead towards promoting gender-based violence. And Ministry of Tourism, because they have come on board the touristic aspects and all that, and we do it with Youth Commission as well. This event now do events where Sierra Leoneans need for come on board on the 25th of April for come let we celebrate Mano River countries, for come let we meet with people that are along the Mano River countries, let we network with other people that where they come up from the Mano River countries, and let we try for promote sustainable development goal 5.
Okay, well, I will come back to you for can talk more on this pageant. Now to Pastor Marie Kade Toure, we now the founder for Holistic Healing Service, where they talk about one exercise we then get for in back on. Firstly, this Holistic Healing Service, within basically una they do?
Well, now the old person, you know, for let the human function well, if not the one aspect somebody you look at is not able for function properly. So now the body, mind, and spirit of the individual. We target the body. Like me, I be the so the sick, they go hospital. Once in a one young doctor go dictate say you get for the exercise. I be so bulky. I be long up to 118. So he say the way the lady, the young doctor talk to me, he moved me. So I take him serious. I find causes they online, do I begin to practicalize waiting at the study. So I find out say it work on me body. I discover say Papa go make more of myself. He puts on a garden, now food for eat more vegetables. You know, now fast food, but people they eat now so the chemical food where they mix down and people they take. And you know we go mix organ with inorganic substance in the hamburg. So most of the things that they happen with health issue there now because of this chemical food there, so now the hamburg we system. So myself I just get the passion, say because myself don't deliver from that bulky, that obesity where they suffer from. So I get passion for help people out. So the office say can come for register, I can help you with your diet and you do that so you will get fit and get to your normal size. Then I want to go academic to schools, develop the PKD, because when I go services, I take as me pilot school, I go services, I discover I say the PKD they're not able to speak English, that's the problem. So being a primary teacher for 36 years, I thought it fit for bringing primary English to the secondary schools. So I say if I bring and come, the PKD go get that boldness there, as these governments come with free quality education. So if the PKD empower they know for speak English, that's simple way. Where they're able for use the is and the words they have and they has, it go able to give them the confidence for speak English in school. So I don't forget English club in schools there, where for aspire the other hand there, for the condition themselves that they always for the speak English in school. Even they come around outside, where they talk to themselves, so that they're able for develop the confidence and the boldness for speak. Because if you want to get boldness, you want to do something, if you are not able to express yourself, you cannot be able to deliver. So I want to inculcate pattern with school going children there, so that they go able for think well and be bold in what they do. So that when their spirits, when their soul they think well, they're gonna for behave with the next companion. You know, you can't give what you don't have. If you don't inculcate this part with school going children that, you get for sure respect, discipline, and all those good qualities them will go develop good nation. So now that make this holistic service come for help with the behavior patterns of people there, the way they eat, their lifestyle, how they eat, they eat well in this country. You know, we don't pass 40 yourself, you know, not to all kind eat to this, we know the exercise, we know they take them, then think they see you. So if you can at the office, they to be Freetown Road, Lumley, just at the junction of Regent Road, adjacent St. Mark's Church. You can there, you go, come, you fill form, you do, you go, not so, we know the charge. Now just passion I get for, and the place I'm in house. Now for just help you go to say, help you incentive for keep, you say go be member, now the organization, and see how you say the outcome you go see. Then you say so go get and go out to your community. By the time you know, Sierra Leone go get fit people for do the work for Sierra Leone.
Okay, so how una get for go about like for do this nutrition exercise una do from different school and now kind school way una the targets for be part of this training?
When I all now what's about I want to focus us with this peninsular schools them, then I come to the central schools them. Now so I want what's the I don't send almost the same letters they're out now for engage the schools there.
So how una get for go about for do this exercise we una get for the do with the school picking them?
No, the exercise not for purposely for the school picking them per se. This the English aspect not for the school picking there. The school there for give me time where we go come together with the picking there. But I get for the give motivational talk for let themselves aspire for greatness. Because there's some people they go school, they don't know why make them they go school. Some might not the way for no more because it's just they go school no more. But one word from a motivational speaker can aspire for greatness. It go change the way they think say I can't school for my future and for better myself and society.
Within for the